Citizens of America and the planet, revolutionaries, welcome to tonight's Fireside Chat. Thank you so much for tuning in. Like this, share it, let's get the word out, because we're going to talk about healthcare. The healthcare that millions don't have, and there are about to be 22 million more if the Senate bill is passed. And let me just say right off the bat, the very good news is that this is extremely unlikely to pass. The Senate can only afford 2 dissenters, and there are many more than that on both sides of the political spectrum. So there's no way that negotiation or compromise is going to be able to meet both the moderate Republicans, like the senator from Maine, for whom killing Planned Parenthood, for whom denying health care to so many people who are dependent on Medicaid, that is namely children, seniors, people in nursing homes, the poor, the disabled, the sick. That's who really gets hurt here. So there are some Republicans of integrity, like Susan Collins, that's the senator from Maine, who are standing up to say no way. And then you have the Rand Paul right-wingers, for whom any kind of health care benefit is just, against their basic political beliefs. So it's looking pretty clear that there's really no way this is going to pass. But the way to make sure is for us to let our senators and our congressmen and women hear from us. They will be coming home over the July recess. The postponement of the vote is actually a great thing, because it means they're going to have to hear from us and be held accountable for this really outrageous attack against the little bit of a healthcare safety net that we still have. So show up, email, text, call, get in touch with your senators and your congressmen and women over the July 4th holiday recess, and let them hear from you. While we're at it, let us hear from you. If you can just chime in, tell us why healthcare is or isn't working for you. Is the Affordable Care Act working? Is your health care affordable? Can you even go to the doctor when you're sick? Can you afford your medications? Let us know what your situation is with health care as we know it, and what would it mean if Obamacare was eliminated? Would you lose your support for your premiums? Would it make your premiums unaffordable? Would it just, throw you to the lions? Or would it be a relief? Would you lose the burden of the healthcare mandate, which is very, very burdensome for low-income working people who can't afford that healthcare mandate? And for many young people who don't have jobs that are, pay a decent wage, and who are healthy for now, it's really difficult. And it's a lousy way to fund a healthcare system on the backs of the working poor, on the backs of the youth who don't have jobs, who are carrying student debt, on the backs of American workers. Unfortunately, that's the premise of Obamacare. It pit working people against the poor, and it provided an expansion of Medicaid, which has been life-saving, but at the cost of really putting enormous economic stress on working people. And in fact, we know that the health of working people has gone down the tubes. The health of working folks who don't have a college education, who only went as far as high school, their health has completely tanked over the last 8 to 10 years or so. In fact, their rates of suicide, of depression, of drug abuse and addiction and alcohol and HIV and the other diseases of drug use have just skyrocketed. In fact, they have the equivalent of the AIDS epidemic going on right now. And is this getting better? No, it's definitely not. We know that the opioid epidemic is actually just completely off the charts right now, not getting better. One of the things that Trumpcare does, by the way, is cut the supports for the treatment of opioid addiction, and in particular for the medications, which are essential. So, you know, this is outrageous. And good thing the American people have basically said no. The approval rate for Trumpcare is something like 17%. And it's Trump supporters, unfortunately, you know, who are really in the target hairs here, who are going to be very hurt by it. So it's 17% support. There's enormous opposition across the political spectrum, especially among independents who have really lost patience with Donald Trump. We're willing to give him a try, and for whom really time has run out, and his ratings are continuing to go downhill. This president, who is Donald the lame duck president really from the get-go, who has not yet managed to pass a single major piece of legislation, and this repeal and replace of Obamacare, you know, was his signature work. So we see how far that's gone, because at the end of the day, you know, Donald Trump represents the bankers and the billionaires, and we the people are standing up to fight back, to resist, to lead the way to an America and a world that works for all of us, and for our critters here, like the Politicat, Willie, and for all of you. The choice should not be between an Obamacare plan that really squeezes working people and provides stripped down, inadequate health plans for many people. Yes, the expansion of Medicaid was great, but beyond that, it's been, shall we say, suboptimal coverage that doesn't cover you when you truly get sick. It should not be a choice between suboptimal coverage on one hand and Trumpcare, you know, on the other. That's not the choice. What we need here is Medicare for all. And why have we not gotten Medicare for all and single payer? Well, remember bait and switch? Remember Max Baucus? Remember the promise that single payer would be considered, and then it was pushed back? Well, not single payer, we were just going to talk about the public option. But then when it came time to testify, single payer and the public option were basically silenced. And doctors and nurses like Dr. Margaret Flowers, who were there at the congressional hearings back in 2008, they were actually arrested and hauled out of the room. And you know, we've just recently seen the Single Payer Act for California stopped in its tracks by the Democratic Speaker of the House. After having passed the Senate, they had to stop it in the House so that you know, so that it wouldn't get so close that people would be up in arms. But we should be up in arms, and the Californians are up in arms. Big shout out to the California Greens, who are out there demonstrating right now on behalf of the single-payer system that we deserve. Let's pass it in California. Let's unleash single-payer. Let's stop the Democratic Speaker of the House from obstructing single-payer yet again, and let's move forward. You can go all the way back, by the way, to single-payer in my home state in Massachusetts, where it was beaten back, having been outspent about 50-1 by the insurance industry and the pharmaceutical industry. It was outspent in a referendum, a voter referendum, where it was beaten by about 2 percentage points. So it was really a moral victory considering how much they spent on it. Well, after that, the Democrats here in this state pushed through basically Romneycare, which was essentially a Republican proposal. It was passed sight unseen by the public, having been released only the night before to be read by the legislators, yet it was passed virtually unanimously by the Democratic legislature on behalf of the insurance companies and the pharmaceutical companies who had basically written it with leadership behind closed doors. This is the paradigm of how business as usual works, not only on Beacon Hill in the Democratic bastion of liberal Democrats here in Massachusetts, but how the Democrats operate and have operated even when they had control of 2 houses of Congress as well as the White House. So this has been bipartisan obstruction of health care as a human right. So we're standing up for what we deserve. The public supports the health care as a human right through an improved Medicare for all health care plan, which saves us money by cutting back on bureaucracy and red tape. Who needs it? Right now it's 30% of your health care dollar is being spent on red tape and paper pushing. So Medicare for all basically slashes that from 30% overhead to more like 2% overhead under Medicare. And it improves the holes that have been knocked into Medicare with the various forms of privatization. It ensures that you're covered head to foot, cradle to grave, everybody in, nobody out, covers all of us with the health care that should be a human right. If anybody saw, what was it, on PBS last night, it was actually Warren Buffett talking with Judy Woodruff, the host of PBS NewsHour. I thought, am I dreaming? Pinch me. But no, they were really saying, Judy Woodruff was actually asking Warren Buffett, well, what about single payer? Do you think it's time for that now? To which he replied, yes. From what I know about single payer, it really is time for us to seriously start considering single payer now. So, there you have it. Even the voice of, what shall we say, corporate America and the billionaires, although, certainly Warren Buffett is one of the more responsible and has said some good things. But there they are now, standing up for single payer. We deserve single payer. The time has come. Like this conversation, share it, because it's important to get the word out that we can beat back Trumpcare, and the alternative to Trumpcare is not the Affordable Health Care Act, which is not affordable and it's not caring. We deserve Medicare for all. We're going to turn to your comments and your questions. Shout out to Robin Ramirez saying, yay, kitty cat. Yeah, that's Willie, the Politicat, sitting right here next to me, if you can see him, right there, keeping guard to make sure we get through this without interruptions, knocks at the door, the pharmaceutical company coming for us, whatever. All right, healthcare stories. From someone who wants to remain anonymous, I was without healthcare recently when I took a semester off school. I had a skin issue. I usually would pay $10 for the medication, but that time it cost me $200 for a medicine that should cost $10. Unbelievable. Under the Affordable Care Act, I would have also been caught out with a $700 plus penalty for not choosing a health care plan, which would have completely sunk me financially. A very familiar story. I'm afraid it's the rule rather than the exception. I'm sure there are lots of people out there who've had very similar experiences. Tell us about them. We'll read them. Even if I don't get to them on this program, I usually go back and read most of the comments. So definitely chime in. Jennifer Morris. I have stage 2 breast cancer, stage 2B breast cancer, and fear the repercussions of getting kicked off Medicaid while undergoing chemo over the next 4 months. Medicaid already denied my immunoinjection, so I have to receive a cheaper, less effective version. Jennifer, my heart goes out to you. I am so concerned about what you are struggling with. Keep us posted, and we are fighting for you. Your fight is the fight of all of us, whether we have a life-threatening disease right now or a disability. Someday we're all going to have that. We're all fighting for the health care that should be a human right for us all. Kelly Paris says, I can't say that I'm affected much, but I keep getting bills for a doctor and specialist visit from months ago, and I'd like these bills to simply stop. Jade Ross says, universal health care only. Melissa Brianna Hamilton, it would be great if I could enroll in health care at any time, not just once a year or during special circumstances. Absolutely, that's how they kind of try to, they pretend they're offering us care and they're not really. Carlos Martin Spivey, I have none. The VA cuts my benefits when I'm not enrolled in classes. Therefore, I'm not covered as of right now. Outrageous. The VA. So people who've gone into the service and have put their lives at risk are being skimped on and denied their health care. Bill Gerhardt, my premium with RMHP is over $1,000 per month, age 61, and I have yet to use it any this year. Thinking of applying to the VA. If turned down, I'm going to go without until age 65 and hope for the best. Boy, unbelievable. Craig Lammers, ACA is dreadful. Can't afford premiums, even with subsidy, as I have other bills. Make too much for Medicaid expansion. That's exactly the problem. With deductible, can't go to doctor anyway. Without single payer, I won't have access to health care for 5.5 years until I'm Medicare eligible. Ames Trujillo, I'm okay for now as long as I don't get really sick, but I worry for all my friends who have chronic conditions. Single payer is the only thing that seems fair. Get rid of the insurance companies. Get profit out of health care. Make sure the money actually goes to real providers. Jesse Harris, affordable care raised my rates to almost $300 a week. It's hurt my brother's health care by raising the rates to the point it's more expensive for him to switch carriers than with this stupid mandate. I hear that over and over as well. People are paying the penalty rather than paying the mandate and then not being able to afford their care anyhow. We are playing Russian roulette with our absolutely inexcusable. And remember, we have the power. We have the wind at our back. This is a crisis not only for Trumpcare, this is a crisis for Obamacare. From the comments you've been hearing, even under Obamacare, people have been in all-out crisis. So this is the time for us to really rally and really push hard. So when your reps come home and your senators come home for the July break, make sure they hear from you, whether it's text, email, phone call, or show up at their office. The solution to Trumpcare is not Obamacare. It's Medicare for all as a human right. If we all stick together and we shout out loud and strong and we don't stop, we're going to move forward. In California, they're coming really close, and we just have to keep pushing at the state level. New York is very close to a Medicare for all bill as well. So let's stick together and remember the words of Alice Walker. The biggest way people give up power is by not knowing we have it to start with. It's time to up the ante and to fight for what we really deserve. Peace EC says, I went on a rant yesterday about single payer and had Democrats liking it until they realized I'm not a Democrat. Some of them then took their likes back. Silly. Jane Garrison, there's no excuse why one of the wealthiest countries in the world is incapable of providing universal health care. Exactly. We spend more money on health care than any other developed country, and yet our health statistics are far worse. We have 2 years less in our lifespan, in our longevity, compared to other countries, other Western European countries and Canada, who spend about half as much as we do. It makes the point, we can do this, we can do much better. And within our own country, there is now a health gap of 20 years of survival. There's a 20-year difference between the wealthiest counties and the poorest counties in how long we survive. This is absolutely a human rights catastrophe. This is a crime to be denying people high quality health care based on what you can afford, based on your wealth, based on your privilege, based largely on the circumstances into which you were born. This is unacceptable. We are standing up and to say no more, no how. Lori Root Riley says, my dialysis patients all get Medicare and it covers all their medical needs. That should be the model. And when we talk to our senators and our congressmen, we have a very simple message. It can simply be, we deserve the same health care you do. You get everything covered, everything paid for. Why is it that our elected officials basically have health care as a human right and we don't? Are we less human than our elected officials? Well, it seems like that's what they think. And that alone is grounds to throw the bums out. This is why, it takes independent politics to lead the way. And it's Greens who are leading the charge right now. So I encourage you to fight this battle, not only for healthcare as a human right, but for housing that we can afford, to end college debt, to make public higher education free, to stop the squandering of our tax dollars, almost half of your income tax being spent on the military, which is not making us safer, it's making us less safe. We can fix these problems. This is all about standing up, standing together, and standing for an America and a world that works for all of us. Couple last comments here. Brisa Martin says, my significant other has asthma even when he had insurance. They refused to pay a penny towards the medicine. $200 a month just to be able to breathe. That's the problem with many of these stripped down plans. They don't cover your pharmaceuticals. I have asthma myself, and when I am not in remission and I don't do the paperwork in advance and jump through the hoops, even with Medicare, it's $200, sometimes it's $400 just for an inhaler. It's outrageous, an inhaler that used to cost like $25. This is unbelievable. Sandy Prisbilak, I'm a volunteer for the Campaign for New York Health to get the New York Health Act, a single-payer insurance bill in New York. It passed the Assembly 3 years in a row. We were lacking one senator to get it to the governor's desk. This is exactly why we have to keep pushing, and it's why, in the words of Frederick Douglass, power concedes nothing without a demand. It never has and it never will. Sign up for the Green Party and start advocating for that New York Health Care Act, and you'll find suddenly the Democrats will start moving when they see that the Greens are gaining traction by being the only voice that's really pushing forward for health care as a human right. Dwayne Fritz says, I lost my Medicaid insurance, $3,000 monthly medicine bill. I lost my specialist, I lost treatments, only 2 MCOs, 6 plans for my age, just wrong to go cold turkey. Absolutely, it's just wrong all around. Jennifer Reed says, the Speaker, Rendon, a California Democrat, tabled SB 562 indefinitely. So get this, SB 562 is the single-payer plan for California. It passed the House, so it was in the Senate, and I guess going really strong, and the Speaker of the House, a Democrat, tables it because who are they serving? They're serving the pharmaceutical companies and the insurance companies. It really tells you, if the Democrats could not pass single payer when they had they had the White House and they had both houses of Congress and they still couldn't pass it, they're not on your side. They're only on your side when they can't possibly pass single payer, and then when they have the power to do it, they don't. So, like the saying goes, fool me once, shame on you, fool me twice, shame on me, fool me 100 times, really, really shame on me. It's time for us to stand up for the health care we deserve. Ames Trujillo, I prepare low-income tax returns, and I physically hurt every time I have someone eat that penalty because the ACA premiums are even less affordable, or ACA wasn't available. This state didn't expand Medicaid. So yeah, damned if you do and damned if you don't. Laura Louise Lacey says, I was billed for a missed appointment while my son was dying in the ICU. I'm so sorry to hear that. Then my primary doctor fired me for slipping and using the word crap one time. Now I'm blacklisted from the entire network and cannot get care in my area. My adult kids are so discouraged that their brother could be given brain damage by the current ALL treatment drugs. I guess he had ALL is a kind of leukemia. That they cannot afford any insurance. So it sounds like they spent so much money on his treatment that the rest of the family cannot afford health insurance right now. This is just one tragedy after another. The bottom line here is we got to stand up. There's a healthcare system that works in just about every advanced, developed country around the world. It works for everyone. It costs far less. People are far healthier, and it covers you entirely. That's what we deserve in this country. And by standing up and standing together, this is the time to push forward. So stay tuned and stay strong. Let's make sure we get health care for everyone as a human right. And let's see, several more wonderful comments here. I'll read just one or two quick ones. Brian Gay says, here in Connecticut, rates continue to skyrocket, increasing by almost 20% this year, Connecticut, which was less than what they initially wanted to raise it by. Meanwhile, companies are pulling out of the exchange, so prices go up for everyone. And if they don't buy, they get penalties. There again, damned if you do and damned if you don't. Heidi Riggins, Democrats need to stop pushing the ACA because less people die. As long as people are dying, it's not acceptable. Ruth Regal Cortinas, how do we get there? How do we put so many companies out of business? I want single payer, but how? So the deal is, we just got to stand up and demand it. Other countries, every other developed country has gotten single payer by standing up and demanding it. And we want to push forward at the state level and push forward at the national level. The name of the game is standing together and standing strong. So lots more to talk about. I'll just make a quick comment that there's another cyber attack going on right now, which you may have heard about. A month ago, there was a so-called ransomware cyber attack, which was attacking businesses and hospitals and governments, 150 countries around the world, which was finally stopped. It was ransomware, and it would basically seize your computer and say, I'm going to destroy all your data unless you send me $300 in Bitcoin. It was finally stopped, but just yesterday, another version started, which has been attacking everyone. It started in Ukraine. It attacked Russia, the Rosneft, Russian energy. It attacked power plants in Ukraine. It attacked Merck Pharmaceuticals. It attacked a hospital in Pennsylvania, at least one hospital, and many other organizations and countries around the world. The important point here is to look at where this came from. Ransomware, in this case yesterday, that's circulating today, and also a month ago, it was developed from basically hacked material that was hacked by the CIA. So it makes the point that a lot of people are hacking here. It's not just a question of finding out who hacked. We need two things. Number one, we need a global treaty against cyber warfare, because everybody's doing it to everybody, including our own CIA, which hacked into Microsoft, that developed essentially these tools that made that created the basis for this big cyber attack right now. So everybody's got to lay down their cyber warfare tools. The only way around this is a treaty. The president of Microsoft, Brad Smith, has been calling for this for months, calling for a Geneva summit for cybersecurity. It's not just a matter of punishing the culprits. As you know, there's so much finger pointing at Russia over the election hacks, and that evidence has not been fully made public. It's clear that many more entities are hacking right now. It's not just Russians. The Russians are being attacked here by these hacks as well. And it may turn out it's Russian mafia, not Russian government. We don't really have public evidence to know. The point, though, should not be, we don't need to wait. We cannot wait for definitive proof about who's hacking in each of these instances. We need to start protecting our systems right now. That includes our election systems, and that's simple. It's paper ballots, it's audits, and it's best practices for cybersecurity that need to be adopted at all levels of our voting system. The odds are we're being hacked in a much deeper way than what has been talked about. They say there's no proof that our voting machines have been hacked, but they're not looking. They have not looked into any of the voting machines. So the absence of proof is not proof of absence. We need to take a look and find out what's been hacked, but above all, we need to start making these systems secure, because there's every reason for people to be very concerned that we cannot have confidence in our voting system right now. As we've been saying in the recount effort for many months, the NSA and the other security agencies and the FBI are actually proving us right that our election system is in fact being hacked. It's very important for us to close the door. The door is wide open right now. Let's close that door and make sure that we have a secure voting system. But we also need to do that in terms of our energy systems, our healthcare systems, all of our cyber information systems. All of our information technology needs to be protected. We need an international treaty against cyber warfare, and we also need support for best practices for cybersecurity. This is not rocket science. This is about we the people standing up and doing the right things. The political parties that are working for the corporations are not doing the job. We are the ones we've been waiting for. It's time to stand up for an America and a world that works for all of us. The power to create that world is not just in our hopes and our dreams, right here and now, on the Green News Network, out there in the networks of resistance. That power is alive and well. Let's make it happen. One reminder, tomorrow night, Ajamu Baraka will be on the Green News Network, and he will be hosting Akeem Browder, who is the brother of the young man who was imprisoned for 3 years approximately, having been accused but not tried or shown to be guilty of stealing a backpack. This was the young man who then tragically committed suicide after getting out of some 2 or 3 years in Rikers prison. And Akeem Browder is he's a man on fire, and he's awesome to listen to. I urge you to tune in tomorrow night for Ajamu, and also tune in here on the Green News Network. After Ajamu, we are going to have some amazing guests for you to listen to and actually to speak with and ask questions. That includes Elizabeth Dickinson, who is an amazing candidate for mayor of Minneapolis. And we'll also have Seth, whose last name escapes me at the moment, but who is an incredible candidate for governor in New Jersey and is making incredible waves. So tune in tomorrow night at 8 o'clock with Ajamu, and tune in to hear some incredible other candidates. And by the way, Ajamu's guest is a candidate for mayor of New York, a Green candidate for mayor who has led the coalition to close down Rikers Prison. Oh, and that name, by the way, the governor candidate who will be with me is Seth Caperdale. Seth Caperdale, incredible candidate for governor, along with governor of New Jersey, along with Elizabeth Dickinson, candidate for mayor of Minneapolis, who will be with me at 9 o'clock tomorrow night. So tune in and feel the love and feel the power. See you tomorrow night. Green news is good news.